So Martin provided a more academical definition about crypto markets. In fact, crypto markets are places where an administrator interacts with vendors, people who sell drugs, and users, people that want to buy drugs. As it has been said, in the last years there has been an increase in popularity of crypto markets that still represent a small fraction of the drug trade at a global level, but it has a potential to grow that is significant. It has also been noticed that law enforcement activity has shown not to obtain long-term or sustaining impact in crypto markets activity. It was told before that there is little research on crypto markets, but the few articles available say this. We are going to take about harm reduction, and we don't like to give the perception that harm reduction is the opposite or against law enforcement. There are complementary things and different approaches. I wanted to show this particularly. And so there are also important aspects that crypto markets create a sense of community. People gather on crypto markets. They gather in forums where people communicate, and there is a sense of pertinence to a specific community. That crypto markets have their own ethics and their own rules and their own codes. I mean, no crypto markets allow sale child pornography, high massive weapons, and I think this is an interesting aspect. Some of them only sell drugs, some only sell other objects, some of them only sell a determined kind of drugs. They are spaces in which communication is very important. There are forums, there are places for evaluate, that they are based in trust and reputation, and I think that was the great idea, the brilliant idea on Zero in the foundation of the first crypto market, because we think that people who use drugs and people who buy drugs, they are miserable. They are criminals, so they don't deserve trust. This model works because there is trust, and it works. And trying to damage trust, it can have an effect, but it can have a negative effect on users' health also. And this point is important. And by the moment, markets are administered by humans, by persons. This is a very important aspect because there are market models based on decentralized use by machines in which you can buy or sell everything you want, and I think this does not good idea. So considering all these factors, and we will finish with this slide, is there a chance for harm reduction on crypto markets? And I will explain our experience of 7 years. I insist in this our experience. You have an idea probably about crypto markets. Maybe when I finish talking, it could seem that crypto markets are Hello Kitty world or something like this. No, I mean we know that in crypto markets there are severe criminal activities. There are very negative aspects, but we are going to highlight other aspects that exist also and that have been lesser known. Okay. So, Energy Control is a Spanish NGO working in the recreational drug use area. We work in many fields, but we have two jewels in our crown: online advice and our drug checking service. It's important to notice that drug checking service have objectives. It's not to tell this is a good pill, this is a bad pill. It's nothing related to this. It's a tool to contact with users and provide them information, a tool to improve the knowledge of drug markets and disseminating this or spread this information. I thought someone told yesterday that drug checking is a fantasy harm reduction. I think if it works, it can work in crypto markets because it's easier to evaluate the results. and in crypto markets, fantasy, reality, the good and the bad, sometimes mixture and mix, and you don't know which is which. So my personal journey in crypto markets started when I registered in Silk Road, and I decided to do the same that I did the 10 years before, just to offer a place in which people could have information about drugs and health. And I did it with my own name to generate trust, and because I have nothing to hide. Well, the story is that played the attention of the administrators of the market of pirate druggers, who highlighted in the market, and this threat became one of the top 10 in a forum of hundreds of thousands of people. I answered hundreds of questions, and this work was replicated in different markets until 2015. I'm not going to follow on this, but this was useful to create this character of Dr. X, and people know that now outside the website and into the crypto markets. And so we generated trust and reputation, and we generated a trustworthy character that was appreciated in the community. And that opened the door to create our Energy Control International brand. That it was conceived as not only for crypto market, but crypto market friendly users. We use Bitcoin and we use PGP encryption, and also a tool to provide drug checking to places where it is not available. Okay? It is noticeable also that the first idea of this service was done by Dwight Roberts, by Silk Road Administration. In our communications, he suggested to create a drug checking service in which he would send us the samples to be tested, and then he would act against bad vendors. But my colleagues that were more common sense, decided that it could have a conflict with that policy, and someone could think that we are cooperating with drug dealing. And so we dismissed this idea, but we chose another one, that is what we do in the streets, that is to act directly with users, a crypto market focused on users. So it's users who send the samples, and we send them back the results. We spread this information in the community. We don't want this information to be available in the newspapers, it has no sense, but harm reduction goes to the users and users are in specific forum of crypto markets that change and in which we are working. This is the Dread Energy Control page. You can see people discussing here about a topic we will talk about, interaction of samples. We have had all the facilities by the administrators to create the forum. They have always offered to send our alerts to each and every one of their users. So when we create an alert, this will go to crypto market users. I think this is an ideal way to reach the population. And I'm showing you some highlights on our test results and the impact provided. These are the data of 5 years of work. It's noticeable the high number of MPS and other substances. I mean, there are cocaine, MDMA, LSD, and amphetamines, and I think we have 300 different categories. We have with almost anything. And we have to be quick and summarize, but to summarize, just to show that in general, most common recreational substances results are competitive. The results are compatible with high competitive markets in which there are high purities, low alteration rates, and low cost. From cocaine, LSD, MDMA, amphetamine, and that common substances, but there are also relevant exceptions. I will focus on two. The first is when we created our first report, it was going to be about fentanyl and fentanyl derivatives, but we found that in a relatively short period of time, we had found that 10 samples from European vendors contaminated with fentanyl. I think we were the first and unique team in publishing this. And we decided not to use a peer-reviewed format because we did a serious research, but it would take many time to be published, and we want to impact on the population. So Dr. X gathered with his chemical brothers and sisters, another superhero superhero people who work in the lab, in the laboratory, and we made this publication in which we showed our results. We receive information of users, and we are not law enforcement, so we cannot act directly, and in general we can take no action. But in one of the cases, we had clear and irrefutable evidences of who was the vendor who was selling the fentanyl samples. I contact the vendor, he didn't answer. I contact the administrator of the market, and this user was banned immediately. A few months
the vendor was banned
by the administration. A few months later, Green Marketplace announced that they finished vending fentanyl or non-fentanyl analogs. It was not only a work of energy control, of course, but we have something to do with these decisions. And so let's focus on the potential role of administration in harm reduction. A noticeable thing is that since we published the alert, we have never found back any sample of heroin from crypto markets. I think it would be it would be too much to say that it was our effect. But it's true that in the last years, most relevant crypto markets have finished or have banned the sale of fentanyl and fentanyl derivatives. There is only one of them who offers pharma-grade products in general. That means that crypto markets are sensitive to what people say and to users' perception, because there has been a lot of discussion about this in forums. But this other sample that I find more interesting or relevant, in January last year, we found a series of samples of alprazolam in powders and in pills contaminated with mixtures of amphetamines. We launched an alert that we replied on April because we saw that this situation was worsening. If you see the data on blue on 2016 and 17, most of the samples we tested contained alprazolam, 50% in 2018, and in the first quarter of 2019, the situation was awful with all different substances, new and psychoactive substances, opium derivatives, and anything you can find. But after this, we found that from April in the last year, this problem disappeared. And I think in this case we have something to relate with this. This is a letter from when we see a tainted substance, we advise the user. This case, I'm not a user, I am a vendor. I have 20,000 pills like this, but I'm not going to put it in the market. And we weren't even able to monitorize that he didn't offer this bill. So that implies the roles of the vendors. Yes, to finish questions, this is a new search, and if you search energy control, we see 167 products that mention our results, because some vendors are using our test results. And this is a big problem for us, because some of them use the code. Some of them, we think and we know that they try to offer they try to offer to the customers the best product, but some of them abuse. They provide fake codes, or they say things that are not related with us. And so one of our work is to go after these people and say no, and in this we have the help of administrators. And we have opened a thread to discuss what can drug vendors do to work in harm reduction instead of using our brand as a proof of quality. So that was the last one. I show you again all these elements that imply not only users but administrators, vendors, and these aspects. And in my opinion, well, this is our field of work, and later we can discuss. Thank you very much, and sorry for the
Thank you, Martin. Thank you, Fernando. This was very thought-provoking. Law enforcement taking down markets has a short-term effect. Working on trust may have a harm reduction effect. Who can I give the floor for questions? Please introduce yourself and then put your question forward. As I said, the entire panel is ready to answer your questions. Anyone?
My name is Daan van der Gouwen, Trimbos Institute in the Netherlands. We're also involved in drug checking. I have a question for Fernando. As you know, these crypto markets come and go, they are being taken down, and also the related forums. How do you deal with that? So you work for quite a long time, I think, on darknet market adventures. But what do you do when the site is taken down? Do you just go to another crypto market? How does that work?
That depends on the situation. When there was a main crypto market, we were in that forum, or I was in that forum. But now there is always a big forum on crypto markets. In this moment, Reddit was the best, was the most. When we started the service, it was on Reddit. But when we finished the program, Reddit banned the forum on crypto markets. Then they migrated to deep web, and that forced them to mix them with other criminal activities. Okay? And in this moment is Dredge, the page of reference. And I insist, we have had, once they were so serious, I had to send my photo, my pic with my Dr. X to be sure that I am Dr. X from agriculture. But in that moment, we were given all kinds of facilities to provide our messages and to launch our campaigns.
There's a question here.
Thank you. Victor Stanners, Ministry of Health from the Netherlands. I have a question to Dr. X, just call it that way. Actually, I was interested. We use the normal internet sometimes for harm reduction, and have then questions on how to get the proper message to the proper target group, because putting it on the internet on crystal meth, or you give too many information to too many people, and you want to target it. Is this also something that is an issue on the darknet, or is the darknet so close that it's not an issue for you? And who do you reach with your harm reduction? So what's your population? Could you explore a little bit more?
Well, first, it's important to notice that online advice, it has positive aspects. It's easy, you can read it direct, but it also has its limitations. It's important to be conscious of this. You cannot provide the same kind of information, and you have to be very prudent on what you say, because you don't know about what is the person you have in front. And in some cases, this online advice is not indicated. It's contraindicated. I mean, it can give more problems. I think it's a good tool for concrete persons who want to know concrete aspects and to provide short answers. I mean, in general. But sometimes there are people who well, it's fun because I am a health professional and people ask to health professionals about cancer, about diabetes, but they don't ask about drugs, sometimes because they fear to be judged. In my experience, sometimes, for example, in the United States, where the health insurance is associated to work, and I think it's sometimes it's difficult. I have markets to detoxify from heroin, sometimes there are how to and say him how to do it. It's difficult it depends. Maybe in Europe it's not a good practice, but and I know some of these cases of people who live in countries where they do not have access to methadone.
It's a one-on-one.
Yeah. See, yes. But in these cases, it has been on private. But if I had this question in public, I would answer it. I mean, you cannot give a general pattern of the toxifying, but there are tables. But it's important always to notice that this advice is specific, limited, and efficacious.
Anyone else? Yes.
Thank you. Dave Bewley-Taylor from Swansea University. Thank you very much for the fascinating and thought-provoking presentations. I think this is more of a question generally for the panel. I'm interested in research methodology. This is obviously a fascinating topic and a very new topic, and I'm wondering what the research challenges are in terms of methodology and how you approach getting data, analysing data, and then translating that data.
There's a number of different data collection strategies that can be used to address questions about crypto market use. The two main ones, and one of the most exciting ones from my point of view, is data collected directly from markets. And the really fantastic thing from the point of view of drug policy scholars like myself about using data taken directly from crypto markets is that they are unbelievably rich because they have information connected to actual purchases. So we have connected to every purchase we can, or nearly every purchase. We know the date, we know the drug purchased, we know the quantity purchased, we know the price of the purchase. We know whether the person who made the purchase was happy with that purchase. We know where the drug was sent from. Sometimes we know where the drug was sent to. We know which vendor from whom that purchase was made. Because this is much more detailed than we could ever have in connection to offline buying of drugs, buying and selling of drugs. We can document trends over time. So, and we can do this in connection to literally millions of drug purchases. Many, many millions actually by now. So this gives us unprecedented information about how drug markets work. So that's one source of information. The second major source of information that we have, there are other approaches too, but the only one that I will highlight here, is self-report data from people who answer questions in surveys. And the biggest survey that asks people questions about their crypto market use is the Global Drug Survey. And the Global Drug Survey, I should have this data to hand. Maybe you have it, don't you?
The last survey was 130,000 people took part.
130,000 people took part.
And that's on an annual basis.
Yeah, so we have very large surveys, and the number of people who have used crypto markets, I think in the first year that question was asked was around 4,000, and in the past year, and it has gone up over time. So again, we're able to, and that study was fantastic. It was one of the things that we didn't mention so far here in talking about some of the harms connected, the relative harms between crypto market buying and selling versus offline buying and selling, is the question of violence and disorder connected to those markets. And one of the studies that was done, unfortunately not one on which I was an author, but it's one of my favorites, is people reported their experiences of having had any threats or violence connected to their purchase when they've made those purchases on crypto markets compared to their typical alternative. And in all cases, experiences of threats and violence were substantially less, even when compared to buying from friends. So for me, one of the most interesting things about all these approaches to doing research is that it allows us to look at one of the questions that is so important to any drug policy researcher, which is what are the unintended consequences of whatever policy approaches that we take. And I think what we've hoped to try to do here today is to say, well, yes, there can be some limited success in very heavy-handed law enforcement approaches like takedowns, but what are the net effects on the things that actually matter to us? Drug harms to people who take drugs, to the people around them, to our violence and disorder in our communities. And what we really need to be looking at is whether forcing people offline will actually increase the very things that we're trying to reduce. And I think that one of the things that we see is that crypto markets have the ability to self-regulate, especially when in conjunction with services like energy control, where they, call people into account when they are not regulating effectively. So that was probably a longer answer than you wanted.
Just a second to add that we have a lot of data, and for us it would be important to have more time to professionally create programs and evaluate the impact. I have shown some data. But for this we need resources, and I wanted to point that I am here talking about Energy Control International and Dr. X. My work is volunteer in this moment, and this work we ask for a fee for samples that covers the cost of the sample. And this work goes on because many people are volunteering. Most of them spend a lot of time for these projects to go on. If we had just a little time more to have time to think and to be able to evaluate things with more calm, I think that we could prove the efficacy of our research.
Anyone else would like to respond to the question on research and data?
No, I think Judith summed it up quite nicely, actually.
Looking. Sorry? Yeah? Yes. Then I may have a question to the panel, but we hear that you're all collecting data, you're looking at what works, what does not. You need some money to do a better evaluation of all the data. There are people from Ministries of Justice and Ministries of Health here in the room. So what advice would you give them for the coming year, looking at what we discussed today? What advice would you give them how to deal with this issue of crypto markets? Thank you. Can I give it?
Yes.
Yep.
I have talked too much.
No, it's okay. You have an instant answer, please.
No. The advice would be just listen to express who are working on this field, because this is a quickly evolving phenomenon, and please have no prejudice. Yeah. I told before that okay, there are really bad guys, there are really good guys, but not all vendors and all administrators and all are necessarily evil in crime. And to interact with them, that's what we try to do, is not to cooperate in drug trafficking. It's the same kind of reasoning of giving condoms to prostitutes is to collaborate in human trafficking. No. But I think it's more difficult to see in this case.
I think, if I may, if you just have another half a minute. I think a key thing to note here is that with the takedowns cause or are strongly linked to innovations. So each time you take down a market, you make the next time you need to infiltrate or counter a market more difficult for yourself. And that means difficulty in terms of the cost of resources, specialist skills required, the amount of time your team has to put into countering the markets. And so if you imagine this on an ever decreasing circle, you get to the point where you need to put in huge resources to find vendors of small substances on a low scale. If those same skills, those same teams, as we know in Europe, are also ordinarily deployed to counter people trading in guns, child pornography, terrorist materials, people trafficking, I should say not on drug crypto markets, but it's the same skill set required, the same teams and budgets. Maybe one thing to consider is, where do you deploy your resources? Is it against a system which has some of these positive, potentially can have some of these positive harm reduction capacities, or is it against those which are clearly wrong and have a very straightforward negativity to them? So that's just something to consider. Thank you.
A supplementary comment to what Martin has just said. When we think of the word harm reduction, we generally think of interventions that are geared towards changing the way that people who use drugs use them. We don't often think about harm reduction interventions in connection to markets, as often. Some people do. I think the implications of the research, the body of evidence that we have presented and that is accumulating in the literature now is that we would advise law enforcement not to ignore what happens on crypto markets, but to target the harmful things that go on crypto markets. The potentially harmful substances, the harmful behaviors by particular vendors, the less well-regulated markets, rather than trying to do everything, take it all down, and then deal with the net harm, potentially net harm increases as a result.
Yeah, sure. I think the only thing I would say is that aside from crypto markets getting harder to take down in relation to law enforcement impact, you've also got to think about what you're driving them towards. At present, we have a model which is somewhat centralized markets. If we continue to crack down on them the way they are, we're going to push people to encrypted messenger apps or to an open bazaar model where you have a total lack of centralization. You're going to have more people who get scammed. You're going to have no oversight mechanisms in place to go after vendors who are selling adulterated products. So if we are going to think about policing this, we need to think about what direction we're policing it towards and what the potential impacts are in terms of their development as well.
Thank you very much. More food for thought. I see one hand raised as a comment. Dan.
If I just may add, exactly what you just mentioned is what we see throughout drug samples. We see that crypto markets, the number of people buying drugs in the crypto market is increasing, but also those who buy on Telegram specifically, and also closed Facebook groups. And we have seen samples, really bad samples, for instance, ketamine sold as heroin and stuff like that. And for us, it's really quite hard to get to those dealers because they're, it's Wild West on Telegram basically, and everything is being offered there. So this is also an unintended consequence of taking down crypto markets, I believe, that people move to areas where there's no supervision by anyone.
Anyone else for a final comment? Then I'd like to thank everyone, especially our panelists of today, for this thought-provoking and food-for-thought discussion. I think we haven't finished. I think this is just the start of our discussion. What shall we do? Well, maybe have a coffee afterwards to discuss. Thank you very much for today.